we start this discussion with the discussion about the inguinal ligament. Now, inguinal ligament, as I had mentioned previously in a previous discussion, that inguinal ligament is nothing but it's a false ligament, by the way. It is nothing but the thickened, folded part of the external oblique aponeurosis. So this over here we have drawn, this is the inguinal ligament. Okay, I'm abbreviating it, hope you understand. So inguinal ligament, this is actually formed by the external oblique aponeurosis. So a ligament is not supposed to be, normally a ligament is not supposed to be formed from a muscular structure. It is supposed to be an osseous structure, a fibrous structure, but in this case it's a musculo-aponeurotic structure. So that's why we say that the inguinal ligament is a false ligament. It's not a true ligament. It's formed due to the upturned folding of the inferior border of the external oblique. By the by, from where to where exactly does this extend? Very simple. This extends from, I'm writing it abbreviated, anterior superior iliac spine of the hip bone. Anterior superior iliac spine extends downwards and medially and attaches to this point, which is called the pubic tubercle. Very, very important point. This pubic tubercle will serve as a point of attachment for many other associated structures of this region. So it's very important. So that's the attachment of the inguinal ligament. So far so good, pretty easy to understand, right? Now try to understand this. Inguinal ligament is formed by the upturned or folding of the external oblique muscle, right? So if we are to take a, you might say, sagittal section, very roughly speaking, we will see that this is the external oblique which is coming down, 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 and then it is folding like this. This region is the inguinal ligament. So this folding, since this is the inguinal ligament, what we say is that the inguinal ligament, this is grooved in its upper surface. The fact that the inguinal ligament is grooved in its upper surface is the foundation for the inguinal canal, which we will talk about in just a bit. Alright, so do you understand why the inguinal ligament is grooved in its upper surface? This is the reason. So far so good, right? Right. Let's now talk about the structures which are attached to the inguinal ligament. If you can understand that this is the hip bone, you can pretty well appreciate that the structure which will be coming downwards, a gross anatomical domain coming downwards, is the lower limb, right? The thigh will be starting from over here, right? So inguinal ligament is serving as a boundary. It's serving as a boundary between the abdominal region and the lower limb region. Consequently, if you remember or if you know this, we'll talk about this in a separate discussion, or we'll talk about this in a separate video, that the fascia of the lower limb, grossly it is known as the fascia lata, right? Fascia lata. This fascia lata, this is actually attached to the lower surface of the inguinal ligament, and that makes sense, right? Fascia lata, obviously it will be surrounding the lower limb regions, right? So the upper part of the fascia lata, we can appreciate that it will be attached to the lower surface of the inguinal ligament, right? As far as the upper surface of the ligament is concerned, this is something that we have already talked about when we were talking about the origin insertion, or rather the attachments of the anterolateral abdominal wall muscles. We had said that the internal oblique muscle and the transversus abdominis, both of them take origin from the lateral part of the inguinal ligament. To be a little bit more precise, internal oblique takes origin from the lateral 2/3, whereas transversus abdominis takes origin from the lateral 1/3 of the inguinal ligament. Obviously, this is not the only point of attachment for those muscles. Their origin insertion is pretty extensive. We had already talked about that. But this is actually serving as a line or point of attachment for those two muscles. So let's just get that out of the way first. Now, the extensions of the inguinal ligament is the reason that this diagram exists. I started with this diagram because this is incredibly simplified a diagram, but this is incredibly important and fundamental as well for understanding that inguinal ligament, although it extends from this to this, anterior superior iliac spine to pubic tubercle, but there are some other structures which are associated with it, which we might say to be extensions of the inguinal ligament. Okay, so there are a few extensions of the inguinal ligament, although we say that it's actually extending from here to here, but a few fibers of inguinal ligament will give origin to some other structures. Let's one by one talk about them. All right. The first fibers that we do talk about, let's talk about these fibers. The fibers that are arching upwards and medially. This dotted line is the midline of the body. If you remember, what structure was this along the midline? Very good, the linea alba. So for all intents and purposes, we can label this as linea alba. Okay. So these fibers that are arching upwards and medially, right? Obviously they are starting from the pubic tubercle, arching upwards and medially. Then they're continuous with the opposite sided fibers of the same thing. These are what we call to be the reflected part of inguinal ligament. This is a very important structure. Why this is a very important structure, why its anatomy is very important to understand, is because this is something which is related to the inguinal canal, right? So this reflected part of inguinal ligament, this is nothing but an extension of the actual inguinal ligament. It's looking as if the inguinal ligament is getting reflected, right? Inguinal ligament stops here. Reflected part of inguinal ligament starts from here. So it's looking as if the inguinal ligament is getting reflected along this part. So these are fibers which are actually passing upwards and medially. Okay. Now, the real thing here is that you can see here, I hope you can appreciate that this thing, this U-shaped thing that has been drawn, this is nothing but the superficial inguinal ring. So when we talk about inguinal canal, we will come to know, or I had already mentioned previously in a discussion, that superficial inguinal ring is nothing but an opening. It's a gap present in the external oblique aponeurosis, present just superolateral to the pubic symphysis, right? It is a gap, it's a opening, you might say, the superficial inguinal ring, and it serves as the outlet for the inguinal canal. We'll talk about it in just a bit. Why I mentioned this in perspective to reflected part of inguinal ligament is to point out to the fact that the reflected fibers of inguinal ligament, they pass behind the superficial inguinal ring. That's why you can see that they are dotted here. Right? So this is an important thing. Keep this in mind, that the reflected part of inguinal ligament passes behind the superficial inguinal ring. How this will be necessary to remember or understand later is when we will talk about the relations of the inguinal canal. Okay. So this is just a fact which is crystal clear from this diagram. Having talked about the reflected part of inguinal ligament, now we are in a position to concentrate more medially at these structures. See, can you see these three lines that I have drawn? This is representing the lacunar ligament. Okay, this is the lacunar ligament, or there is another name for this. It is known as the pectineal part of inguinal ligament. Why I had to mention both of these names is obviously since lacunar ligament is the more catchy name. So you will obviously remember that. Why I mentioned pectineal part of inguinal ligament as well is because if you remember that this part is also known as the pectineal part of inguinal ligament, you will automatically remember, since there is a pectineal in the name, you will remember that an attachment of this ligament will be at the pecten pubis, right? So it's a free mnemonic, so you should take it, right? It's a free mnemonic. Just by remembering that this part is called the pectineal part of inguinal ligament, pectineal, so it has an attachment at the pecten pubis. Okay, so anteriorly, if you can understand, see again, this is a three-dimensional model. All right, we'll see to this in the atlas as well, but this is a three-dimensional model. So this is more anteriorly, the inguinal ligament is more anteriorly, and this, although it is looking as if it is superiorly, this is actually a little posteriorly. In the 3D model, this lacunar ligament, the pectineal ligament, these are posteriorly oriented. All right. So this lacunar ligament, it is actually attached, the anterior part of the lacunar ligament, this is attached to the medial part of the inguinal ligament. Very, very clear from here, right? As you can also see that the lacunar ligament is a triangular ligament, very, very self-evident. So it has a base and an apex. The apex obviously is attached to the pubic tubercle, no problem with that. Whereas, as you can see, the base is kind of free. It is free, not really attached to anything. Okay, okay. So that's that about the lacunar ligament, I guess. And this is actually, okay, so this is the, as I mentioned, this is a 3D model. So inguinal ligament is more anteriorly, this is more posteriorly, and this lacunar ligament, this is somewhat horizontal. Can you imagine how the lacunar ligament is placed? We'll see to that in the model. Just remember, for now, you will understand it later, that the lacunar ligament is horizontally placed. And obviously, it has an anterior part attached to the medial half of the inguinal ligament, and a posterior part. Oh, by the way, I actually forgot to mention the posterior part. The posterior part, as you can see, it is actually attached, or rather it is giving origin to another extension of the inguinal ligament. This is called this line. See, the posterior part, they are attached to this line, or rather actually from this posterior fibers, posterior part of the lacunar ligament, this fibers or this ligament is coming into play. This is called the pectineal ligament. Okay, so this is called the pectineal ligament. So posteriorly, this lacunar ligament is attached to the pecten pubis. Remember, I had said that the pectineal part of inguinal ligament, pectineal, this part is coming in the name, so it is the pecten pubis attachment. It has a pecten pubis attachment. Where exactly does it have a pecten pubis attachment? Along the posterior part. Now see how well this goes with the logic that since this ligament is called pectineal ligament, this pectineal ligament is attached along the pecten pubis as well, which actually checks out because the lacunar ligament's posterior part is attached to the pecten pubis, and the pectineal ligament along here there is the pecten pubis, so the pectineal ligament is also attached along the pecten pubis, right? And it is actually an extension, as I mentioned, from the posterior part of the base of the lacunar ligament, and obviously it is attached to the pecten pubis, right? The last kind of fibers that remain, the last extension that remains, is given off from the inguinal ligament's middle part, somewhat middle part. This is what we call to be the intercrural fibers. See, I had mentioned about the superficial inguinal ring, right? These two sides of the superficial inguinal ring, by the way, the superficial inguinal ring is somewhat triangular in shape. So the two sides of the inguinal superficial inguinal ring, they are called the two crura. They are said to be the two crura of the superficial inguinal ring. From the lateral crura of the superficial inguinal ring, the reflected part of inguinal ligament takes origin. So I had mentioned that the reflected part of inguinal ligament, it is coming from the more or less the pubic tubercle, but from where exactly is it taking the origin? It is taking origin from the lateral crura. This is the lateral crura, this is the medial crura. I hope you can get that. From the lateral crura of the superficial inguinal ring. I had forgot to mention that, I'm sorry for that. Right? So what does that have to do with intercrural fibers? Now see, the name itself is telling you intercrural, and I just mentioned that these are the two crura. So intercrural fibers, what they're doing, they are running from the middle of the inguinal ligament towards the two crura, and they are actually keeping the two crura attached together. They're actually keeping the crura attached together. In the atlas, this will be very much clear as to how this is happening. Okay, so this is just to give you a basic overlay, a very simple overlay of the inguinal ligament and its